Good Saturday morning. I guess it's not really morning anymore, it's afternoon here. This is Dr. McDaniel, and it's Saturday, May 11th. Obviously, we don't have office hours today, so I came up with an idea as the introduction states on HCG, which is the pregnancy hormone. I decided on this topic because a lot of times when women come in to get the pregnancy test done, they don't really understand what the pregnancy test is measuring, how the hormone works, and they think that the pregnancy test is going to tell them exactly how far along the pregnancy is, which of course is not the case. So HCG stands for human chorionogonadotropin. HCG, human chorionogonadotropin, and that is the hormone that's produced by pregnancy. Now, specifically, that hormone is produced by the placenta, not by the fetus or the baby. So this pregnancy hormone measures the production of hormones that the placenta produces as it continues to grow and as it grows appropriately with appropriate blood supply. Now, HCG is usually detectable around 3 weeks, 3 weeks in 1 day, 3 weeks in 2 days of pregnancy, and medically we count pregnancy as starting with the onset of ovulation, when fertilization should have occurred, but I guess I should say realistically, but medically we count it with the first day of the last menstrual cycle. So we know someone obviously is not pregnant with the first day of their last menstrual cycle, that they're not going to be pregnant until they've ovulated. But traditionally in medicine that's counted because before we knew about ovulation, before we could assess when someone ovulated, we did know when they had their last menstrual cycle, and we knew when they stopped getting their menstrual cycle, and we know that menstrual cycles are every 4 weeks. So it was an easy form of measurement for everyone. Even now, obviously, we have an average or a statistical basis on when someone should ovulate, but for any given individual woman, we can't state exactly when she ovulated for that pregnancy unless she was getting some kind of fertility treatment or fertility help that in which case we would have been measuring when she ovulated. Now, human chorionogonadotropin is a hormone produced by the placenta, but it allows us to measure the progress of the pregnancy because obviously as the placenta grows, the pregnancy or the baby is growing with it. HCG, as I stated, is detectable in the bloodstream around 3 weeks, 3 weeks in 1 day, usually in the urine around 3 weeks in 2 days, 3 weeks in 3 days. It used to be that there was a large gap between the urine and the blood for when we would be able to measure that someone was pregnant. Sorry, we have 2 dogs. This one dog, we have a German Pinscher, and we have a Yorkie and a German. We have a Yorkie and a German Pinscher, and this German Pinscher is always barking when I'm outside. Traditionally they used to lag about a week to 2 weeks. Now the lag is only about a day or so. So for the blood pregnancy hormone, it's measured in milli international units, and someone is usually considered pregnant if that number is 5 MIUs or above. For the urine, same story. For the urine, it's measured in basically just qualitative, not quantitative, so it's a yay or a nay for the urine. And if we correlate the urine is positive usually at what's equal in the blood to around 20 to 25 MIUs, which realistically speaking is only about a day. So it used to be that if we did the urine pregnancy test, it was negative, we would check the blood and it might be positive, and that gap was about a week, sometimes 2 weeks. Nowadays, it's only about a day. So realistically speaking, if someone's urine pregnancy test is negative, the blood is going to be negative also. Now, a lot of people think that there's a high rate of false negatives and false positives with the urine or the blood, and that's just not true. Now, you can get a false negative if you check your urine or you check your blood too soon. Obviously, if you're not pregnant yet, it's going to be negative. Then you might check it in another 4 to 5 days. It'll be positive. It's not that it was a false negative, it's that you checked it too soon. Implantation had not occurred, and then the hormone, obviously, which is due to implantation of the placenta, and then the hormone being released into the bloodstream, that hormone's not going to be positive if you're checking the urine or the blood too soon. As I stated, we start counting the pregnancy with the first day of the last menstrual cycle. So realistically, when we say that someone is 3 weeks and 2 days pregnant, they're a little over a week pregnant, but that's how medically the standard is. The blood pregnancy test will not tell us exactly how far along someone's pregnancy is, but it will give us a ballpark range or an estimate, a generalization on how far along that person is. But it's a broad generalization, so the minimum number is what we look at. We don't look at the maximum because the range could be like 20,000 MIUs, so it's not very helpful. If someone is just pregnant, say they're 3 weeks and 2 days, 3 weeks and 5 days, then that hormone number realistically is going to be fairly low. It could be as low as 25, 30, or it could be as high, even at 3.5 weeks, as high as 1,000, 1,200. So as you can see, it's not super helpful, but it gives us a ballpark. So if someone comes in and based on their last menstrual cycle, they should be 3.5 weeks. I do the blood hormone and it's 1,200, 1,500. I'll tell them, doesn't really look like it's 3.5 weeks. It looks like it might be more like 4.5 or even 5 weeks. But if someone comes in and they're supposed to be 6 weeks and the hormone number's only 400 or 500, I know that person can't really be 6 weeks at a number 400, 500. That's going to be more consistent with 3.5 weeks. So that's how it helps us. Now, I'll mention later on how we use the numbers more specifically if there's a question about an appropriate pregnancy being in the uterus versus the tubes or an ectopic, or if it looks like someone's miscarrying, how we're able to use those hormones more beneficially. So as I stated, the pregnancy hormone number comes from the placenta, not from the fetus. And for that reason, even if someone has a very, very early miscarriage, which we used to call a blighted ovum, now we call it an embryonic demise, which just means the pregnancy stopped so early that they never even developed a fetus. It just stopped around a fetus that we can see on ultrasound. We can see a fetus on ultrasound, which we call a fetal pole, around 6 weeks. We can't see the heart beating till around 6.5 weeks. We can see the tiny little sac or bag of water, and we won't be able to see the fetus in it as early as 5 weeks. But say someone is supposed to be 6.5 weeks. The hormones look like 6.5 weeks, but we do the sonogram and there isn't a fetus. It looks like a 5-week pregnancy. So that would be explained because the hormones continue to grow or continue to increase because the placenta, the very, very immature placenta, we call that the chorion, that very immature placenta has continued to grow even though the pregnancy is not normal, the fetus isn't growing, and we can't see a fetus. So that's how that situation could occur. Tomorrow I'll continue on with HCG, human chorionic gonadotropin, which is the pregnancy hormone, and I'll give more detail into how we use it medically to help differentiate between different types of pregnancies. Thank you for watching. This is Dr. McDaniel. Please check out the YouTube channel. It's called GYN Corner. My 11-year-old son, Justin, he helped me spruce it up a little bit. It was looking pretty bland, so he was able to put my logo up and a background for the GYN Corner on YouTube, so I'm pretty happy about that. Of course, he asked me to pay him $5 for it because he's 11, but I was happy to do it. So check out the YouTube channel, GYN Corner, and I have all of the topics delineated there. So it has each of the sessions along with what the topic is. It's difficult to locate things here on Facebook. But everyone have a great rest of the day. It's really nice here in New York, New Jersey area. It's nice and sunny. Not super warm, but it's not cold either. It's just a little bit cool. So have a great rest of the day, and I'll be back tomorrow. Thank you.